Hello and welcome. This is Deepak Mishra and I welcome you all to DMiNetz International. Today we come again with a success story interview with Dr. Prem Vignesh. Dr. Prem Vignesh is a general surgeon from India. He's done his residency from India and now he's in Germany. He has recently passed his Fachsprachprüfung and is preparing for his Kenntnisprüfung exam. We will just talk to him and see if he has any tips and insights for us for this process, for this pathway towards post-graduation in Germany, towards his career, toward career as a doctor in Germany. All right. So, Prem.
Hi, sir.
How are you?
Yeah, I'm good.
So how does it feel passing the Fachsprachprüfung?
Yeah, I mean, I took the Fachsprachprüfung on the 14th of March, and yeah, luckily got through, and I had it in Münster. So it's usually a little on the tougher side in Münster, and at the end, it all like turned out well, and I'm happy with the result, I would say. Yeah.
Wonderful. So, Prem, could you please, for our viewers, introduce yourself, like about yourself, where you have studied, and how long have you been in Germany? What was your path? Little bit something, some details about those.
Yeah. So my medicine I did in Pondicherry, and my MS General Surgery I did from Ramchandra Medical College in Chennai. So that was 3 years. So when I was in the beginning of my second year, this whole thing about Germany really like captivated me, and I thought like after my MBBS, I actually wanted to go to Australia. That was the initial plan, and eventually things didn't work out, and I ended up doing general surgery in India. You know, I've always wanted to do surgery, but at the end of the day, I always wanted to have, I always like traveling and moving around a lot. And, I've always been fascinated by surgical education in Europe, and settling somewhere in Europe was always the aim in some way. And
Probably
when
that comes because your father is also a surgeon.
Yeah, my dad is also a surgeon, and yeah, and he is also somebody who strongly supported me in all of this. And he said, like, you know, uh, if that's what you want to do, you should do it. And so I always had the familial backing, and so yeah. So as soon as I was in my second year, then I did a lot of research. I watched a lot of your videos on how
Okay.
to get into Germany, and I thought, okay, this seems interesting and this seems doable. And so that's when I started doing my German language levels. So I started with A1 to B1. It's this carry-on German course in Goethe. So that was like 3.5 or 4 months course from A1 to B1.
Okay.
I did that and also B2 in my second year of general surgery. And in my final year, I had to naturally concentrate on general surgery and in my final
Yes.
exam. So there was a bit of a break, but I used this year to further improve my language. I was watching a lot of German media and stuff like that. And I also applied to a lot of hospitations. I mean, I was also in constant touch with you, and you were also guiding me as to what I should do as, on a step by step
Right, I
basis.
remember you were among the one of the first candidates who
Yeah.
enrolled with consulting program. Like in fact, that time the name was not there, DMiNetz was not there, but like you were one of the first candidates, and I am very happy today to interview you on your success. Yeah, so you were like, as far as I remember, our first call that was that time you were second year resident in your general surgery
Yes,
residency.
yes.
Yes,
I was just
yes.
entering second year, I guess. Yeah.
All right, all right. And now you have come like, and when did you complete your post-graduation?
I completed it in March or April 2019.
2019.
So, so I planned it in such a way that April I completed my and my results came in May, beginning of
Mhm.
May,
Yeah,
and end of June I was in Germany. So
right, right.
I planned
We
it in
had
such a
planned
way
accordingly. Yes,
that yeah,
we planned with that strategy that I always say during my videos that this strategy and planning is very important. That as soon as you have your results, you should
yeah,
be out. That was the plan right from the beginning, right? So luckily that worked out well for you.
yeah.
So tell us about your coming to Germany. Why did you come? Like, as in, you came on what kind of visa did you come with? What purpose? And how has your plan been so far? Like you came in June, July, you said, right?
End of June and July. Actually, end of June, I came here to do like a laparoscopic fellowship in Strasbourg in France. And then as soon as that was done, then I came to Germany, and then, it all,
Yes,
the
I
process.
remember we were talking on phone, and I was in Aachen. I had my like own interview over there, and then we
You had
talked
your
over
way there.
phone, and you had like just arrived.
That's it.
So you came here for what purpose did you come, Prem? Could you tell us to our viewers?
So first, I would like to tell my earlier travel to Germany. That was my first time in 2018. In February, I had come. That was a very cold winter, and I had come for a pancreatic surgery workshop in Heidelberg University. And there is somebody called Professor Buchler, is one of the best pancreatic surgeons in the world. So I mean, I was really impressed with the system and what they do and all of that. So eventually, that was sort of like this goal for me, that once I come to Germany, and once I know that it's going to be a long process to get used to a new language, a new culture, and everything's going to be in German, not just the language, but the medical language, the communication with patients, all of it. So that's going to take some time. But I knew that once that's done, and like 2-3 years of me being in Germany, I could even go somewhere which is like closer to Heidelberg, so to say. So that was kind of the plan, and that so far things have gone well. But I mean, I still have a long way to go, I would say.
Definitely. This is the first hurdle. No, this is the second hurdle that you have like overcome, but there are a few more hurdles to come. And hopefully with the determination and the dedication that you have displayed over the last couple of years, I'm very sure that you will reach all those plans and all those ambitions that you have. I'm very certain about that. So you came here, this trip that you mentioned, that was in 2018. That was prior to this
February
final
2018.
trip.
Yes.
Yes.
That was my first trip. It was kind of like a feeler for me. Like I wanted to know what life in Germany would be like, and how's the hospital system like, and all of that. And I must say, I had finished my B1 and I was doing my B2 course by then. So I could communicate very little. Not like, even with the B1, B2, you're not going to communicate so much. But I was able to understand everything they said, and I was able to communicate in my own way. And I was really happy with the quality of life people were having, and I was able to talk to a lot of people, and that kind of like cemented it for me that I should really like.
This is where your future is. This is where you want to be.
Yep.
Right. So, and when you came after your residency, the plan was such that you will apply for hospitation, as you have already mentioned, and as soon as you get hospitation, you will apply. So, tell our viewers, because I get a lot of questions about is hospitation visa possible? Because many people, many consultants even say that no, that is nonsense. A hospitation visa, you're just wasting your time. But in my experience, including you, the other people who have come, like around 7-8 people have already come to Germany through our consulting services, and everybody has gotten hospitation visa. So could you also confirm that what was your visa, and what did you apply for deficit Bescheid? If yes, then what was the plan?
I had applied for deficit Bescheid, but by the time I applied for my visa, the deficit Bescheid hadn't come. So I went through with my visa process, and I did get a hospitation visa, the so-called Category D training visa. So I was able to get it. And the deficit Bescheid came in later, but I don't think I required it because the visa was already there by the time it came.
That is also the plan through which we function. The DMiNetz always says that, okay, it's not that we are not applying. We will apply, but then we will not wait for it, because sometimes when it takes, you had applied in Northern Westfalen, so it came in like 2-3 months time, I think. And some places it takes 6 months. So when it is not affordable, it's not wise to just wait 6 months to wait for that paper. So that is why I always say in my consulting programs, and also on YouTube, that one should not wait for it. I mean, it gives safety that, okay, 17A visa is a better, like it's more easily accepted visa, approved visa. But then if your documentation is proper, and if your interview skills are proper, the things which we prepared for interview, in your case, it was not difficult because you were already a surgeon. But if the preparation is there, then hospitation visa is also not a thing, I mean, to much worry about. I mean, preparation obviously has to be proper. So
So
Prem,
one
now
thing
tell
I
us.
also say is that I was a little bit lucky with applying to the consulate in Chennai, because I've heard that the consulate in Mumbai and in some of the other places are a little too unstringent, that strict about things. Sometimes they might expect a deficit Bescheid and stuff like that. But in my case, I think I was also lucky in some way.
Yes, true, very, very true. And luck comes, I mean, in my case, like I have seen in last 4 months, we have had 3, 4 candidates coming from Mumbai, and everybody has gotten hospitation visa without deficit Bescheid.
Okay.
Documents are here, but they have not been processed so far.
Yeah.
Okay,
I guess
so
how you answer the visa
exactly the
officers, that
preparation.
also matters a lot. Like
Yes.
if you give very dubious answers, then obviously they're not going to give you the required visa, I guess.
Yes. That is what I have like realized, that in spite of people, like one candidate was like telling me that, sir, my friends are saying that it's not possible. Then I told her to find like smarter friends, basically.
Yeah.
So, all right. So now we have cleared that, okay, hospitation visa, you have also gotten it. So it is doable. Not easy, but it is doable.
Yeah.
Fine. Moving to the next point, how is your expectation? How has been your like experience, not expectation, experience as hospitant working in a Deutsche Krankenhaus? Like,
Yeah.
what did you do? What have you learned? And what things do you think is missing? Like, what you could do better?
Yeah. So at the outset, I'd like to say that, applying for hospitations is a bit of a pain in the ass. We should apply to as many hospitals as possible. And there was a hospital in Brandenburg which was really promising, and they told me, even a job at a later site is possible. But they said at the last moment that, they had to back out on it, and then I had to apply for more hospitations, and then so I was planning on applying all my documents for approbation in Brandenburg. And then at the
Yes.
last minute, they backed out. Then I had to apply to all the other states, and it was only in NRW and Siegen. But it was also a nice hospital in Siegen, St. Marien Krankenhaus. They had given me a 3-month hospitation, so I had to like redo all my documents and send it to NRW. And NRW, the good thing about NRW is that, which is North Rhine-Westphalen, is that all the documents get processed really fast, and you get a
Yes.
termine also faster. So if one is ready for the whole process, if they want it to be fast, I think NRW is a good state. But the only thing is the exams are a little more difficult than
Yes,
the other
exactly,
states.
exactly. That is the entire problem. That, okay, if you're
Yeah,
confident for the exam,
yeah,
if you're prepared so well that you can, I mean, you are ready. I mean, nobody is 100% ready, but still there is a feeling that, okay, I have prepared well and I can take this exam. And then NRW is good because there are more hospitals. Things function more efficiently here in NRW. That is why there are more applicants as well. And then that is why the level of exams is high.
yeah.
At present, because of the corona situation, they're saying that they will loosen things up, but I don't believe that they are going to do anything in
Yeah.
that regard. All right.
So
So this is
the
okay. Yeah,
first
about
hospitation was
hospitation.
in Siegen. Yeah. Also, both my hospitations I did was in the Department of Allgemein und Visceralchirurgie, because I mean that is like the Zielabteilung für mich. And so the first one was in Siegen, and they have a very good case output as well, and so I got to be on daily rounds, and every day begins with a Frühbesprechung, which begins
Okay.
at 7:15 in the morning. So you get to sit with all the other Assistenzärzte, the Oberärzte, and
Hmm.
the Chefarzt, and they're going to discuss what was done in the dienst the previous day, and what is going to be the OP plan for the coming day, and is there a difficult Röntgen or a CT builder that somebody should discuss, and all of that is discussed. And the first few days you're not going to understand head or tail. It takes some time, at least 2 weeks, for you to get used to the whole routine. And then you go for the Chefarztvisite or the Oberarztvisite, and which is basically the rounds, along with your assistants who you're going to follow. And once you're done with that, then you help with Blutentnahme, stuff like that.
Hmm.
And I since I had a Facharzt from India, So they were more willing to like all the time get me to the OP, and I got to assist some nice cases as well, I should say. But you can only do that as a hospitant, only assist. You're not going to be doing much because the seal at the end of the day is language, and trying to understand what the Alltag, so to say, the day-to-day activities of a hospital is like. So that went on for 3 months, and I think that was a really good experience. And the second hospitation for me was in Hamburg, in Uniklinikum Hamburg, Eppendorf, and that is like almost like a concrete jungle. I mean, there's so many people there, and it's one of the biggest hospitals here in Germany. So it was a lot of work, and I was, even though it's a department of surgery, they have different teams in different color coded names. So I was in something called a team green, which was focusing only on endocrine and pancreatic surgery. And so the good thing is you would see a whole lot of things like robotic surgery, this, I mean, and a whole lot of very challenging cases being handled, and you will get some really good contacts. But the flip side to doing a hospitation in a really big uniclinic is that nobody is going to know you other than your immediate 3-4 people in that. If I work in the green team, the chef arts didn't even know that I existed. So that's how, yeah, that's how it goes in the big uni clinics, because the chef arts, they don't even know the Assistenzärzte Name most of the time. So I guess so I kind of like the Ziegen experience much better than the Hamburg experience. But at the end of the day, I also want to like be in an uni clinic at some point. But I guess starting out in a smaller place is always better, especially
definitely. It's a better
first
decision.
into Germany. So that was my experience with the hospitations, I would say. But it really did help me with the language. But I guess 2 hospitations or 1 hospitation of 3-4 months is a good enough quota, I would say.
So do you think that, I mean, for your Fachsprachprüfung training, I mean, you were also enrolled with our FSP online FSP training course, and people who watch our videos have definitely seen you. Maybe they will recognize you. Okay, this guy, he was doing that Gallenstein case and all those things. I mean, the videos that you have posted 6-8 months back. I think 6 months back. At that time, I was working at Uni Halle, and that time we were doing this rigorous training. So that course, and then your hospitations during, I mean, in Ziegen and in Hamburg. How do you think? How much have these helped you, and how much has sitting at home and reading books helped you? How would you say for your Fachsprachprüfung?
Yeah. Me being a surgeon, I've never been so keen on reading a lot of books, and I cannot sit for hours together for like 4-5 hours and sit and read and read and read. I'm always somebody who reads fast, and I pick up things fast, but I can't read for a long time. So I guess the course really helped me, the online course that we did, because the timings were really flexible, and it could really be arranged between the hospitation, and I could come back and I could do this, and I could I had time to understand what was done in the course, and maybe read a little bit on that. And so it really helped me with everything. I should say that, especially with all of you guys teaching for the FSP, you guys have an inside knowledge. I mean, you've been working here as assistant editor for quite some time, so I guess it was really helpful for me to understand how the exam is going to be, what the pattern is going to be like, and what are the topics and how I should approach it. And we also had some simulations, so that was also very, very helpful, I would say. Yeah.
That was my next question, because I tried to give as much as, because we, how much ever work experience we might have, the language barrier is always there. The Aussprache, the pronunciations, as we do not have that kind of pronunciations as native German do. That is why we have enrolled or like hired medical students and interns. That guy was an intern who was with us, and so that they could simulate as patients, and then you could try. And that was my question, like, how beneficial did you find that simulation thing?
Yeah, one of my problems was also that I from second year I did my B2 and all of that, so I had to do all of this like part-time, doing my residency in India, doing surgery. And I'm sure people from India know how hectic doing residency in India is like. So I had to do all of this part-time. So my attendance in Goethe was hardly 40-50%. So I mean, I should say I didn't do the B2 course in a very ideal way, but I was able to clear it. But at the end of the day, so it is my experience only after coming to Germany that my language improved a lot. And I took a good like 5-6 months to completely get the right Aussprache and, speak more fluently and stuff like that. And I thought the simulation was really helpful. And I mean, we did quite a lot of sessions, and he also prepared,
Yes,
like
yes.
simulated
He prepared
cases.
really well.
Yes. So I guess that really did help me. And Münster is altogether a new beast in some way, that because
Yes.
they have their own level of difficulty, and it is not just about the subject. They really go deep into the theory, but it's not just about the theory. Even if we make mistakes with the theory and we are very good with the language, we can clear Münster, I would say. Because
Okay.
Münster, it was all about, if you ask a question to the patient and the patient says something, you have to build on that. It's about the Nachfragen. And if we ask a question, the patient says something, and we go ahead and ask some other question which we already had in our mind, then
Then
that
it's
doesn't make a good
abgebrochen.
impression.
That's the system is
Yeah, in
then
Münster, you
broken.
should always continue on what the patient says, and then
Okay.
build up on that and ask, probe, stuff like that. I mean, if you're able to do that, that is the seal in Münster, I think, for
So,
FSP.
Prem,
So,
during your hospitation,
yeah.
what do you think that if you had done that, then your experience would have been more like better, I would say, during those hospitation? Is there anything that you could have done more or better, or done language like more severely, like intensively, or how is it like, so that your experience or the output that you could gain from the
Yeah.
hospitation that could have been better?
Yeah.
What is that thing?
I guess in the hospitations, yeah, I got about 2 weeks in an ambulance, which is
Hmm.
like an emergency.
OPD. Yes.
It's like an emergency OP, like
Not ambulance, you mean?
no,
Not for
not
long.
ambulance, not
Okay.
ambulance.
Yeah, yeah.
So I guess that time was really useful in that sense, that you get to see a lot of cases and you get to. But the only problem is in Ziegen, I had the freedom to get histories from the patients and stuff like that, but that I didn't find in Hamburg. So
Okay.
it all depends on where you do your hospitation and whether they allow you to really like go to the patients and
Yeah.
conduct a lot of like anamnese or Untersuchung or whatever you want, or do they not give you that independence? That is
Okay.
also a question. So I guess I would have ideally liked to spend more time in the emergency department, that is the note ambulance.
Okay. Problem with the hospitation, about, as you mentioned very correctly, that but thing is that you do not know which hospital will allow you, which will not allow you,
Yeah.
because on paper everybody writes that it is just shadowing, like
Yeah.
you are not supposed to open your mouth, you're not supposed to touch anything. So on paper everybody is going to write that, and which hospital actually allows you to take anamnese, draw blood, that is only when you know through experience. Like for example, now I know the place that you have, at one place it was allowed, another place was not allowed. Only that is the way one can know. Otherwise on paper nobody, and one cannot also ask like, okay, will I be allowed this? You cannot ask that. It's not allowed actually by law.
Yeah.
All right, Prem. I will conclude this video here because it's getting longer than
Yeah.
expected. But then we are going to make a new video where
Yeah.
we will talk about the Fachsprachprüfung exam experience per se, and your preparation for that, and the tips that you have for the doctors. That we are going to do just now. But I'll just keep this video short so that it's easy to upload and all.
Yeah. Sure.